Brooke.
Hello.
My name is Shannon. I am a nurse practitioner student at the University of North Dakota. And I'm going to be doing your assessment today. Do you have anything that is bothering you or anything that you want to go over or any questions before we get started?
No, ma'am.
Okay. Basically what I'm going to do is just start at the top and kind of do a head to toe. We're going to look at your head, your eyes, ears, all that stuff, and if anything is bothering you when we get to it, just let me know and we'll kind of focus in on that. So I'm just going to start out looking at your head, feeling for any masses, any pain.
No, ma'am.
Okay, got normal hair distribution. The scalp is clean. No evidence of lice or anything else. Can you look at me? What about smile? Can you frown? Puff out your cheeks. Blow out with, clench your eyes closed. Cranial nerve 7 is intact. Looking at your eyes, they're symmetrical on the head. The lashes swoop out away from the globe, which is good. I'm going to have you hold this about 14 inches from your face and read to me the lowest line that you can.
37425 8.
Okay. And vision is 20/20. Do you have contacts in?
No, ma'am.
Uncorrected. I'm going to just check real quick with the uncover test. Okay, that's good. Any pain in your sinuses?
No.
What about here?
No.
Okay, what about right here? Can you open your mouth and close it? Okay. Any pain? That's your TM joint. Okay. And one thing I'm going to do is just have you pick out a spot on the wall and look at it. The pupils are equal and round. They're reactive both directly and consensually. I'm gonna just shine the light. Focus right here. Actually, I'm going to turn this down a little bit. Okay, and the anterior chamber looks good. The light reflex is equal in both eyes. And one thing I'm going to do is I'm going to come in and look at the ophthalmic area of your eye, and I'm going to get really close to you, so let me know if that bothers you anyway, okay? And I'm going to kind of hang on to your red light reflex is present. And I can visualize arterioles and veins. The optic disc is present in yellow. No drusen bodies seen. One thing I want you to do is follow my finger with just your eyes. Now I want you to tell me when you can see my fingers in your line of vision. Now. Now. I'm going to just thinking through my head to make sure I've got everything. I'm going to go on to your ears. Have you had any pain in your ears?
No.
I'm going to stand to the side and I'm going to whisper 3 things. And I want you to tell me what you hear.
Okay. A, B, C.
Okay. And now I'm going to do a couple of tests with the tuning fork just to test your hearing. The first thing is the Weber test, and I'm going to hit this and put it on top of your head. I want you to tell me if you can hear it equally in both ears.
Okay.
Okay. The next test is the Renee test, and I'm gonna put it on this bone back behind your ear. I want you to tell me when you can no longer hear it. And then I'm gonna move it beside your ear, and I want you to tell me when you can no longer hear that.
Okay.
Okay?
Okay, it's gone. It's gone.
Okay. It wasn't quite 2 to 1, so I'm gonna test this ear, and see if there's any difference. Are you ready? Actually, I'm gonna come over here.
Okay. Okay.
Okay, that was better. Can I borrow a pen? I just need to write, I'm gonna write this down. So the right ear was 8 and 14, and the left ear was 8 and 22. Okay. Now I'm just gonna take a peek in. There's a little redness, but the tympanic membrane itself is pearly gray. The canal is just a little red, but no buildup of wax or anything like that. Looking at your nose, it's symmetrical on the face. I'm gonna have you hold one nostril and breathe in and out. And now the other side. Okay, now I'll have you close your eyes, and I'm gonna put something under your nose, and I want you to tell me, it's not offensive smell, but I want you to tell me if you can recognize it.
The cinnamon.
Okay, open your eyes. Oh, cranial nerve 1 is intact, and I'm just gonna take a peek up inside there. I'm not gonna stick this real far up your nose, but the septum is midline. A little red, the mucosa is a little red, but the inferior turbinates I can visualize. Okay, on to the mouth. I'm going to have you open up and say "ah." Okay, it's a little red as well, but the uvula is midline. Cranial nerve 10 is intact. I'm gonna just check out the inside of your mouth. I'm gonna feel around to see if I feel any masses or lesions. Can you just open up? Don't feel any masses or lesions. Dentition is normal. Can you stick your tongue out? What about from side to side? Okay, that's good. I'm going to look at your neck, and trachea appears midline. You go ahead and feel your preauricular, post-auricular, occipital, posterior cervical, anterior cervical, retropharyngeal, submandibular, submental. I'm going to go under your arm here, axillary, and your epitrochlear. Lymph nodes, and none of those were palpable. Were there any tenderness in any of those? Okay, one other thing. Can you swallow? Good. cranial nerve 9 is intact. Swallow again. Okay. I don't feel any palpable masses on the thyroid. Feel your carotid pulse. Irregular. Just taking a minute to see. Can you look up? Now look down and to the left and right. Good. Range of motion is intact. I want you to try to shrug your shoulders. Good. Now try to push against my hand. And this way. Good. Cranial nerve 11 is intact. Now, I'm going to just put your hair over to the side. I'm going to move on to your back, and I'm going to undo this just a little bit so I can kind of see. And then I'll tie you back up. Okay. Inspection looks good. I'm going to have you say the words 99
99.
again.
99.
Again.
99.
Good. Tactile frenitus is equal bilaterally. Any pain?
No. Your hands were
Are they warm?
good. Yes.
Okay, can you take a deep breath in and out for me? Good. And again. Good. Thoracic expansion is equal bilaterally. Any pain there? What about on that side? Okay. Any pain that way? Okay. I'm going to come around to this side just because it's easier for me to do it that way. Okay, one thing I'm going to have you do is take in a deep breath, and I want you to hold it.
Okay.
All right, go ahead. Okay, breathe. Now I want you to take in a deep breath, blow it all out, and hold it. Okay, you can breathe. Diaphragmatic excursion is 4.5. centimeters. And now I'm just going to listen to you. Big breath in and out. Lungs are clear, respirations are even. And actually this one I'm going to kind of undo the front of your gown just a little bit. Actually I might as well just do that. I'm just going to inspect. Okay, and now I'm going to feel your precordium, so I'm going to kind of go up under here. I'm going to listen. I'm going to go up underneath. Okay. Now I'm going to have you scoot back and just lay back, and I'm going to do this whole rigmarole again. I'll button you back up. And in palpating or feeling the podium, I don't feel any thrills. I don't see any heaves. I don't hear any evidence of any murmurs. The rate's regular. I'm going to have you roll onto your left side, and I'm going to listen to you again. Sorry.
You're okay.
Okay. Again, I don't hear, the rhythm is regular. I don't hear any murmurs or splitting. S1, S2 is present. Just go ahead and stay laying on your back. Capillary refill is brisk in less than 3 seconds. No edema. I'm gonna feel your brachial pulse. Actually, I'm gonna do them simultaneously. I'm gonna do your, it's kind of hard, but I'm gonna try to get in here and do your femoral pulses. And your popliteals. Dorsalis pedis, all of those are equal. I'm going to kind of have you relax your leg and bend your, now I'm going to tell me if this hurts. Any pain on that? Any pain there? Okay. I don't see any ankle clonus. Can I take this sock off?
Yes. Bad nail job.
We're not focusing in on that. I'm going to check your Babinski reflex, so just relax your leg. Let me get this. Okay, that's negative. And while I'm up here, I might as well just do, I'm going to palpate your apical and your carotid at the same time. And those are symmetrical. Can you turn your head just a little bit? I don't see any evidence of jugular vein distension. Also going to palpate your inguinal lymph nodes. I don't see anything there. You put your sock back on for you.
Thank you.
You're welcome. Okay. I'll go on to your abdomen. So, do you want me to pull these down so I can pull the sheet up a little bit
Yeah, that's
over you. Oh, you're just not be flopping in the wind. Okay. There's no evidence of ascites or a few striae, but the skin is smooth. I'm going to listen to you. Vowel sounds are present in all 4 quadrants. I'm going to concuss. Okay, now I'm going to try and percuss your liver span. I'll get these marks off of you when we go. And that is 6 centimeters. I'm going to try to palpate deep. Tell me if there's any pain with this. Take a deep breath in and hold it. Okay, you can breathe. What about on this side? Any pain? Pain there. I'm not able to palpate the spleen, the gallbladder. I don't feel any obvious masses or lesions. And I'm going to check your abdominal reflexes. Abdominal reflexes are intact. Umbilical ring, I don't feel any masses or lesions on that. Okay, I think what I'm going to have you do is actually get up. And I'm going to pull your socks off. I'll tie you up so you don't give everybody a show. Take my socks off, is that what you said? Yeah, we'll take your socks off so I only have you walk barefoot. Just like over to the door. Alright, you ready?
Mm-hmm.
Now, can you walk back a few times on your heels? Okay, what about your tippy toes?
Mm-hmm.
All right. Now, can you do heel to toe? I don't even know if I can do it. Good. Now, hop on one foot. Okay, good. Now, what I'm going to have you do is just stand with your feet together and your arms at your side and just stand there for a few seconds. And now I'm going to have you close your eyes and stay just like that. Okay, you can open them. There was just a little bit of slight sway, but that's normal. So you can kind of relax now. I'm going to have you raise your arms up over your head. And now can you reach back behind with one hand And now back up like this. Use this hand. Yeah, there you go. Use that. Go across your body and away from the body. Okay, so shoulder flexion, hyperextension, internal, external rotation, and abduction. Adduction is intact. I'm going to have you sit down real quick so I can check your hip.
All the way down?
Yes, just kind of lay back. I should have had you do this before you got up. I'm sorry.
That's okay.
All right, just lay back. And then I'm going to have you lift this leg up and can cross it over. Okay, and now let me do that. Internal and external rotation. Any pain with that? Okay. Now you can get back up. Sorry, it's just that one thing. Can you do your leg out behind, holding on to me? Okay, good. Now lift your leg up. Any problem with that? So hip range of motion is intact. You can have a seat on the edge of the bed. Now I want to see if you can do like this. Good. Now touch your fingers together to your thumb. Good. Now can you touch your finger to my finger, and then to your nose, and then back to my finger, to your nose. Good. Cerebellar functions are intact. What I'm going to do is have you hold your hand out, and I'm going to put something in your hand with your eyes closed.
Okay.
And I want you to feel of it and tell me if you know what it is. You ready? Okay.
It's a paper clip.
Good. All right. Now I want you to keep your eyes closed. And I'm going to touch you at 2 different spots at the same time. And I want you to tell me when you can no longer tell when I'm touching you at 2 different spots on your palm. Okay, you
Okay.
ready?
Okay.
Right there.
Jewelry and handbags, so 25% off for the 12 days of Christmas. All Christmas and jewelry, along with handbags, so 25% off.
Oh, that's
For the
basically
12 days
like
of Christmas in the gift shop.
3 inches or maybe centimeters. Or like 5 centimeters. Now I'm going to have you close your eyes, and I'm going to touch you with something soft, and I want you to tell me where I'm touching you.
Okay.
You ready?
My face.
My right arm.
My left leg.
Okay, good. So stereognosis was intact. I'm going to have you hold your hand out and close your eyes. I'm going to draw a number on your hand, and I want you to tell me what it is.
8.
Good. Graphesthesia is intact. And I'm going to check your reflexes. So the first one I'm going to do is your bicep. Okay. Just relax your arm. Do you feel anything? I don't feel anything either, so we're going to go on to your brachial radial, just kind of pronate it a little bit. Let your arm hang loose. Are you relaxed?
No.
Now are you?
Mm-hmm.
Okay. I'm not getting any reflexes. Let's test this one. Let's try this. Your Achilles. Just relax your hand. Or your leg. Yeah. I've already done the Babinski and checked for clonus. There's no ankle clonus. A lot of the reflexes wasn't getting, so the patellar was
hard for me
okay.
to relax.
Yeah. I think I'm done, so I'm gonna check my notes and how much time do I have left?
15 minutes.
Ooh. When I was examining your eyes, I didn't see any evidence of ptosis. One other thing I'm gonna have you do is take the heel of one leg and run it up the shin of the other, and then, good, okay. I didn't notice any nystagmus or ptosis when I was examining your eyes. One other thing we normally check is a corneal reflex. We take a wisp of cotton and touch it to your cornea to elicit a blink, and we're not going to do that. I also, the conjunctiva is pink and moist, the sclera is white. We also normally would check for a gag reflex, but since you were able to swallow okay and no problems, then we're going to kind of skip that. Since I have time, I'm going to look really quickly just to make sure I got everything.